Sam. My name is Suzy. I'll be your nurse again today. I'm going to continue our head to toe assessment that we started last time. Before we begin, I'm just going to make sure that we have some privacy, and I'm going to wash my hands. And I would just like to see your wristband. Could I just get your name and date of birth, please?
Sam Nemes, Jan 1083.
Okay. All right, so I was looking at the doctor's order, and he wants me to do an assessment of your abdomen today, of all four quadrants, and the range of motion in your lower extremities as well as your upper extremities, as well as strength, and check for any tenderness in any of your extremities. Is that okay with you?
Sounds good.
And we're also going to take the pulse in some of your lower extremities. Okay, I'll just wash my hand one more time. I think I did once already, but that's okay. Okay, so I'm going to start with your abdomen. So if you can just roll up your shirt to about your chest level. And to start with, I'm going to note that his belly button is in the midline of his stomach and that his umbilicus is inverted. I'm going to check for the protuberant scaphoid. Primer stay. And I'm just going to note that there is no protuberant scaphoid, and I'm going to check for any contouring and roundness and any additional bumps by shining the light this way, and then I would walk around to the other side and shine it this way. And I'm noting that he has one lump between his 12th rib and about his 10th rib in there. I'll mark that down. Other than that, I didn't notice any abnormalities in your abdomen. Then I'm going to auscultate, and I'm going to start in your right lower quadrant, and I'll go counterclockwise. Clockwise, counterclockwise. So we'll go that way. Okay, so I'm going to start auscultating and just listening for any abdominal sounds. And I'm just going to make sure that I clean this first before I begin with my invisible alcohol swab. And I'm noting some abdominal sounds in his sphygmoid colon here. And when I move to the upper quadrant on the left side, I'm now in his descending colon. And again, I'm noting some abdominal sounds. And moving upwards to his left upper quadrant and across along the transverse colon. Definitely some more peristalsis going on in there. And going down to his ascending colon, or intestine. Okay, so I noted that there was some abdominal sounds, and they were normal. They weren't hyperactive or hypoactive. They were normal. It sounded like you had some food moving through there, so that was good. Next, we're going to percuss your abdomen, and I'm going to be listening for dullness, which would be over any solid organs, and I'll also be listening for any tympany, which would be over any air-filled organs. Typically, the dullness would be in your upper quadrants, and the tympany would be in your lower quadrants, where your intestines are. Have you gone to the bathroom recently?
I have.
Okay, so is your bladder empty?
I hope so.
Okay, we'll find out. I'll percuss over it. Okay, I'm going to start again in your right lower quadrant, and I'm just going to percuss. And I'm noting some tympany already. Oop, I punched my patient. Sorry, patient. And it's getting more dull, and I'm guessing that there's near your stomach and your the tail of your pancreas, and you must have just eaten some popcorn. It's definitely more dull up there, and again some dullness noted right where his liver should be, and tympany down there where his intestines are. Okay, and I'm going to now palpate the same regions again. I will just do a light palpation and just let me know if there's any tenderness while I do that. And I'm just going to be feeling also for any abnormal lumps. So we'll start in your right lower quadrant again. And left upper quadrant. Left lower quadrant. Underneath your umbilicus. And back to the right lower quadrant. Did you have any tenderness while I was doing that?
Nope.
No? Okay, and it felt like your bladder was empty to me. So I think that concludes our abdominal assessment. So you can go ahead and pull your shirt down. Now we're going to go down and we're going to make sure that your legs are underneath the pillow here. Your knees are on top of that pillow. See, you have my your emotional support animal next to you. I'm going to check your popliteal pulse to begin with, and that's behind your knee. After that, I'm going to take your socks off, and then I'm going to I'll check your dorsalis pedis pulse as well as your posterior tibialis pulse. So your we're going to start with your popliteal, which again is behind your knee. So if you can just relax, and I'll just find that pulse. And I know that it's a little bit medial to the midline. And then I'll assess this side at the same time, and just relax. Put your weight on my hands. And I will find it. Okay. Okay, so your popliteal pulse was a bit hard to feel, so I'll give it about a +1. But I did note that the rhythm was regular on both sides, although possibly they weren't synced up quite with each other. After this, I'm going to palpate your dorsalis pedis pulse, which is on the top of your foot. So I'm just going to walk around here and get my cameraman to walk around this way. Okay. Find one first. There. Having trouble finding. Oh, there we go. Okay, and I'm noticing that the rate and rhythm are normal, and I noticed that the pulse on the right foot was slightly ahead of the one on the left foot, but it was still a regular rate. Now I'll check your posterior tibialis pulse, which is in the inside of your foot here. Get on that quickly. Okay, so that pulse I would say is quite a bit stronger than the one on top than his dorsalis pedis. I would give that a +2. The rhythm was regular and strong, but I did notice that again on the right side it was slightly ahead of the one on the left side, although they were regular, the rhythm was regular. Now I'm going to check for start your range of motion and strength and tenderness test or palpation, and we're going to start in your hips. So I'm just going to start here in your hips, and just let me know if you feel any tenderness. I'm just going to palpate it to begin with. That's okay?
Yep.
All right, so we'll check the range of motion in your hips as well. We're going to start with your right side. So what I'm going to get you to do is I'm going to get you to raise your right foot up to the ceiling if you can. Okay, good. And then if you can just flex your knee, and we're just going to flex a little bit more towards your head. Okay, good. And then we're going to check the strength right away since we're in this position. So I'm going to put my hand on your knee here, and I'm just going to provide some resistance while you push against my hand. Okay, and then again this way you can push against my foot. Okay, that's good. You can put that down. And now we're going to do the same thing on your left side. If you can raise your left foot up to the ceiling. Okay, and if you can flex your knee again and bring that closer to your head. Okay, so we're just gonna check the flexion there. And again, you're just gonna push against my hand towards your head. Okay, and then again, my foot as well. All right, so I noted that his range of motion seemed to be equal bilaterally. The strength was equal bilaterally in his hips. We're gonna also do the inward rotation and external rotation of your hips. And to do that, I'll just get you to curl your toes towards each other. Bring your toes towards each other, and that's your inward rotation. And now if you can bring them away from each other, that's your external rotation. It looks like that was done with ease. I didn't note any crepitus while you were doing that. And then if we're going to do abduction and adduction, so to do abduction, you have to bring your leg to your side laterally, so, and then that's your abduction, and then bring it back, that's your adduction. If you do the same thing on your right side, abduction, and then back in, that's adduction. Okay, so that completes the hip assessment. Now we'll go down to the knees, and I'm just going to palpate that again. Not noting any edema or erythema, no bruising. I note that there's one scar here. I know from his records that he has had meniscus and ACL surgery in the past. And I note that his left knee is also bigger than his right knee, although it isn't. There's no edema there. It feels like a hard mass, like it's part of his knee. Again, that must have been from a previous injury. Okay, and I'll just palpate in the back here. And from his expression, I don't note any tenderness, and I'll just confirm that with him. Are you okay?
Nope, it's all good.
Okay, so we'll check the range of motion now in your knee. So if you could just flex your knee up and then bring your toes towards the ceiling. This is flexion, and then if you could bring your heel towards your bum. Sorry, that was extension. This is extension, and then back down, that's flexion. Okay, and then we'll compare that with the other side. We'll check the strength afterwards. Okay, if you could bring your knee up and then toe to the ceiling, extension, and then back down. Okay, so this is his flexion, and his flexion is almost at a 90-degree angle, which isn't as much as this side. Again, that must be from your surgery that you've had in the past. Okay, so since we're in this position, I'll just check the strength of your foot. So if you can just, again, push against my hand. Okay, and then push against my hand again. Okay, and then you can put your leg down. And then we'll check the strength on this side as well. So if you can just push against my hand. Okay, and then again, push against my hand. Whew, he's strong. Okay, you can put your foot down. Again, the strength is equal bilaterally. And now we'll move down to your ankles. And before I check the strength, I'm just going to palpate it again. Checking for any edema or any pitting or any tenderness. Is that okay?
It's good.
All right. Okay, it looks like it's okay. Now if I can get you to dorsiflex and pull your toes towards your nose. Okay, that's checking the range of motion that way. Now if you could plantar flex, that could be wrong.
Plantar flexion?
Plantar flexion. And I'm looking at my notes for the first time.
The
Dorsiflexion and
plantar flexion.
Plantar flexion. Yep, I was right. Now we're going to check for inversion. So if you could bring your feet towards each other like this, and then if you could bring them away from each other. And it seemed to be a little bit stiff in there. You can't quite bring it in all the way.
Oh, there's stuff.
Yeah. But I could see that there was equal bilaterally. So that was good. So we're going to also check the muscle strength in your foot. So if you can, again, just pull your feet up towards against the resistance of my hands. Okay, good. I have to brace myself because he's going to knock me over. And then push against my hands again. Okay, good. And then we will check his toes. And I'm just noting that there are some bumps on his toes. And previously he said that he was wearing shoes that were too small on him when he went through a massive growth spurt when he was a teenager. But I'm going to also palpate and just let me know if there's any pain. Are you feeling any discomfort?
Nope.
No? Okay. So if you can just, again, extend your toes outwards and flex them inwards. Okay, now if you can abduct them and adduct them.
Hi, Dad.
Yeah, and he's not having
Hi,
good luck
Dad.
with that either. That's what happens when you go through puberty very quickly. And then we're going to check the strength of your toes as well. So again, like we did before, just push against the resistance of my fingers. Okay, and then we'll go this way as well. Okay. And that concludes our lower extremities assessment. So now we will do upper extremities. So if you can just sit on the side of the bed here. And I'll just take my notes in case I need them. Okay, so first I'm going to check for any, going to check for symmetry, and we're going to check the size of his chest. Again, as I'm moving along, I'm checking for bruising, erythema, edema, or any abnormal discolorations, any moles or scars or anything like that. And I'm noting that it's symmetrical on both sides. He has broad shoulders like a man should have, or some men don't, I guess. That's okay too.
An ideal man has broad shoulders.
In the confines of education. Yes, in a hospital, maybe it's okay. Okay, so we're going to start with a forward flexion of your shoulders. So if you can bring your shoulders forward, or you can just copy me. First before we begin, I'm just going to make sure that you are not in pain, that you can actually do this. So I'm just going to palpate your shoulders and just let me know if there's any discomfort. Is that okay?
Sometimes when I shrug them.
When you shrug them? Oh, okay. Okay, so if you can bring your shoulders up, we're just checking the 11th cranial nerve to see if you can do that, and bring it back down. And then I'm going to provide resistance again if you can push against my hands. Okay, so there is strength bilaterally, again, equal bilaterally, so that was good. And then we will go on to the forward flexion. So if you can bring your hands forward and just do what I do. And this will be forward flexion all the way up, and then back down. And then I have to think about this for a little bit. We will do, yes. I have a good sidekick here. Okay, so we're gonna do internal rotation and external rotation again. So if you can put your hands in this position, this is internal rotation, and then up this way, that's external rotation, and then just back down again for inward rotation. Okay, and then just bring your hands to your side, and now we're going to abduct and adduct again. So abduction would be bringing your hands up to the side over like this, and adduction is bringing them in front of you and crossing over. Okay, and that concludes our shoulder assessment. So I'll move down now to your elbows. So I'll just palpate them, and again, let me know if you have any pain or discomfort. And I'm not noting any unusual signs in his elbows either, not on his skin or anything. So to start with, if you can bring your hands up in front of you like this, and then we're gonna flex towards your body, and then extend away from your body. And then if you can bring your hands like this into the supination position, and then turn them over into pronation position. And again, supination. And then bring your arms back up. So we just checked his range of motion. Now I will check his strength. So again, I'm just pull against my resistance here. I just have to brace myself. And then this way as well, just push against my hands. Gonna get knocked over doing that one. Okay, so that we checked his elbows. Now we will go down to his wrists. And I'm just going to, again, palpate them for any tenderness, edema, or checking his skin out while I'm going down. Is that okay? It's not painful?
It's good.
Okay, so now if you can put your hands in pronation again, and then if we can, if you turn them in, this will be the radial deviation, and then we're going to turn them out to ulnar deviation, and then if you can open them up and then flex them in, and then hyperextend them out, and then we will check the strength in his wrist. So if you can just put your hands on your lap here, and again, just pull against my resistance. Pull your fingers towards your body, okay? And then we will check your fingers. I'm going to check all the joints in your fingers as well. So in your thumb, in your knuckles, in any joints of your fingers. I'm not noting any abnormalities or any swelling. Was that painful at all?
No.
Okay, so now for this one, we're going to flex inwards and extend out. And then if you can abduct them and adduct them, And then that would be our range of motion for that. And now I will also check the strength in his hands. So I'm just going to cross my fingers over and my hands, and you can just squeeze them both. Okay, so I'm noting again that his strength was equal bilaterally. His range of motion was equal bilaterally throughout as well. And I didn't note any, other than the score there and then the bump on his chest, which I will note, I didn't note any abnormalities. So I think that concludes our assessment. Do you have any questions?
No.
Okay, thanks for your time, and I'll see you in 1 week to do the remainder of our assessment. Have a good day.
Thank
Wash
you.
my hands.